Those are all good, but I want to make sure that we focus on preventative measures for all of us. I mentioned that one of the things that I do in martial arts, I teach people how to fall. This is to keep you from falling. So there is a different approach to that. So today, as yesterday we dealt with reversing diabetes, today we wanted to make sure something that's going to be done that is practical, that is physical, and that you can use. Yesterday we dealt with things on the inside of you. Today is going to be more on the outside. And it's going to be a practical presentation, which means that I know that you will be participating in things. You won't be just spectators today. The thing about fall prevention is that intellectual information is only so far. If you don't put physical skill sets into practice, then it becomes what we call a dead skill. You don't use it, you forget it, and when you need it, it's gone. So that's going to be important. Today, I'm excited to have presenting with us a young lady who has distinguished herself in the area of not only as a PT, but also an exercise physiologist. Dr. Nikki Carrington is currently the director of physical therapy and rehab for Howard University Hospital. And I know that she specializes, I've seen her over the years, specializing in individuals who are injured. So she has worked with a wide spectrum of physical conditions. She has trained athletes. She's trained sports teams, football teams. But I believe her specialty is really working with those who are physically limited by surgery, by accidents, by other life-altering issues. She is one of those individuals who come. I've seen her in personal practice, working with individuals with patience and longevity to restore wholeness. Isn't that good to know? And that's the kind of person she is. And I know that personally because over the last 20 years since I've known her, we've done some things together. And she wouldn't be here with me if she didn't demonstrate a kind of expertise and sensitivity and caring. In fact, no one on the team would be here unless they did it. Like Rhonda and now Nikki, if I don't have a high respect for what you do, we don't, Health Ministries, we step up our game, not down the game. So we want to bring in the best. Dr. Nikki Carrington is accompanied today by her mother, who is here. Mom, just raise your hand. We're so glad that she is here with us also. We praise God. They're out of the Metropolitan Church and the DMV area. Her pastor is now the president of the Allegheny East Conference. So we're delighted that they are here with us. So I'm going to want you to welcome Dr. Nikki Carrington. She's going to say, call me Nikki, but I want you to welcome her as a distinguished individual. And whatever she asks you to do, just smile and do it in Jesus' name. And Nikki, thank you for being with us.
Thank you. Thank you. Good morning, Allegheny East. I'm really happy to see such a great crowd. It's a lot more people than I had expected to be here this morning, so that's wonderful. I'd like to thank Pastor Medley, and he was very kind. Let me just tell you, Pastor Medley and I have a love relationship that sometimes doesn't always end in smiles. So I like to say one thing about Pastor Medley we know is that he is committed to the cause of health. And one thing I admire so much about him is that he doesn't just talk it, he walks it. Doesn't he look good today in his white? I thought he looked young. I said, who is that standing down there? Anyway, this morning, everybody, I'm here to talk to you guys about creating balance. We talk about balance all the time, specifically post-pandemic. All I ever hear when I'm at work, around, people are always, I want balance in my life. Oh, what about my work-life balance? How about balance of the mind, the body, and the soul? Also emotional, physical, and spiritual. So today I'm here to actually talk to you about physical balance and the importance of it and why it matters for us. So, why is balance so important? Well, balance is important because it helps us to maintain and prevent falls, right? Everybody is afraid as they start aging about falling and injuring themselves. And also, it just helps to make doing simple activities much easier for us to perform. Um, Falls as the number one factor as why people need to maintain their balance. It represents the most common mechanism of injury and the leading cause of death for people that are over 65 years old. Did you know that? Even though falls are very common throughout the lifespan, when children fall, they don't really end in hurting themselves. They may get some bumps and bruises, but not so much for us as we begin to age, right? Our consequences are a lot more critical, and sometimes it can be deadly. All right, so let's define fall. So today I'm going to take some time. I'm going to teach you guys some things. We're going to talk about things. I'll give you a chance to answer or ask me any questions that I can answer. And then we're going to be physical. Is that going to be okay? So I'm so sorry. I'm not a technical person. I know some people are visual learners. So you will get that opportunity when I actually demonstrate things to you. So if you need me to slow down, you want me to repeat something as you're taking notes, please feel free, raise your hand and just let me know, okay? All right, so let's define falls. Falls are defined as an unintentional loss of balance that leads to failure of postural control or a sudden and unexpected change in position, which usually leads to landing on the floor. According to the CDC, falls are the leading cause of injuries and deaths among older adults in the U.S. More than 1 in 4 adults over 65 years old report falling each year, and over half of the people over the age of 80 fall annually. So let's take a moment to be transparent. How many people in this room has fallen over the last 6 months? Okay. How about anybody over the last year? How about anybody who's fallen twice in the last year? You would be considered a very high fall risk. 2 falls within 12 to 6 months is considered your risk factor for falls. Okay? So this is for you. And I want you to take it seriously because it is really important. Okay. About 37% of those who fall report an injury that requires medical treatment that limits their activity for at least 1 day. In 2021, over 38,000 older adults died from unintentional falls. This makes falls the 5th leading cause of death for people over 65 years old. That was alarming for me to find. The 5th leading cause, that's pretty scary. That's high up there. That's less than 10. So, in 2021, nearly 2.9 million adults were treated in the emergency department for falls, which is 20% of an increase over the last decade. There were about 1 million fall-related hospitalizations among older adults each year. In 2019, falls were responsible for 83% of hip fractures and the deaths of them. 88% of the emergency department visits and hospitalizations were due to hip fractures. So that's pretty important. And what makes it so important is that when people are getting older and their mobility is decreasing and they break something in their lower extremity that causes them to lose more mobility, it increases their chance of mortality. So it's very important to know that one of the risk factors for increasing or decreasing your mortality is to be mobile. The less mobile you are, the higher incidence you have of an early death. I know, let me just say this. I'm not here to try to scare people. I just want you to understand the importance of being able to stay on your feet. Now, As Pastor Melly told you, I work at Howard University Hospital, and if any one of you are familiar with the area of Howard University, you know that we work for the underserved. That is our population. Those are our customers. And what happens is you get them coming in, and a lot of people, they can't wait to get a referral so they can get a wheelchair or motorized wheelchair or something that, they don't have to walk anymore. And it's so hard to explain to people the importance of staying on your feet and why it is important. It's not a good thing. It's not, when you go into the grocery store, if you can walk around and you're not, you feel safe, don't get in those carts. Why? These are all the things that are helping you to keep moving. And keeping moving as you age keeps you independent. And you want to be independent. Ask my mama. So, yes. So, all right. So the risk factors that we find for people who have a more increased risk of falls, in the American Academy of Neurology lists different guidelines that suggest people with certain diagnoses are at higher risk of falls. Those diagnoses are strokes, dementia, walking and balance problems, history of recent falls, and people who use walking aids such as crutches and walkers. These are people who are higher risk of falls. People with Parkinson's disease, peripheral neuropathy, lower extremity weakness or sensory loss, and substantial loss of vision are also probable risk factors. Taking multiple medications, issues with certain drug interactions can further impair balance. Medications such as antidepressants, anti-anxiety drugs, sedatives, tranquilizers, diuretics, and sleep medications are related to increasing the risk of your falling. Environmental hazards such as slippery walking surfaces, loose rugs, poor lighting, obstacles in the way of your walking path can further increase the risk of falling in individuals who already have a compromised balance. So the take-home message is that as the number of risk factors increase, there's an associated risk of falling. Decreasing the number of risk factors can decrease a person's risk of falling. And identifying those risk factors for falls can help to guide in an intervention program. So let me give you some tips and some homework that you need to do when you go home. When you go home, I'd like for you to take the time to walk around your house and look for those beautiful rugs that put you on the floor all the time. You may want to pick them up. Make sure that they're secured on the ends, they're not rolled up, and they don't move. Because those rugs, sometimes they slip around and they move. You want to make sure if you have tiles, they're not cracked, they're not loose, and there are none that are missing. You want to make sure that you have cleared all of the pathways that you use in the hall, in your room, throughout the bathroom. If you have a lot of boxes and packed items and you have a tiny little path that you walk through, oh, I can get through that. No, you can't. Please pick it up. If you use a walker or a cane or crutches, please make sure that you use that in the house. Oh, when I'm walking in the house, I don't need this walker. Well, how did you fall? Well, I was holding on to the counter. You know that the counter is a form of your walker, or if you don't want to use a cane or crutches, if you're walking with someone and you're holding their arm, you are still using a walking device. It's the other person. Understand, if you fall, so may they. So that's not a good idea. Use your walking aids throughout the house and at all times. Don't think that you can do it without it, because those are also increases in risk factors for people. Make sure that when you're getting up in the middle of the night, maybe to go to the bathroom or whatever you need to do, you're turning on your light. If you're not turning the light on, please have night lights throughout the house so that you can see where you're going. If you have children in the house and their toys and socks and shoes, make sure all of that is out of the way and put in their particular places. Also, making sure that when you are sitting up, so from lying down or sitting, there's something called orthostatic hypotension. And what that is when you go from a lying to a sitting position or from sitting to standing, it can cause your blood pressure to drop. So I know you feel that sometimes, don't you? You sit up, get up from bed, and you're dizzy. Don't stand up. Why do people do that? Wait. Let the dizziness subside. Pump your feet, tap your feet, let that circulation get pumping, get the blood back going up. Once your dizziness has gone away, then stand up and go to where you're going. Because the dizziness, our body is always trying to maintain what's called homeostasis. And that's another form of balance. It's always trying to maintain its balance. And if you're not giving it that time, body's stronger than you. It's going to say, listen, we need this blood pressure to settle. So you lay down for a minute. And this is how it works. And this is why people faint a lot, because it's trying to help you correct what it needs, and this is the result of it. So I tell people all the time, respect the symptoms, respect it, because it's telling you something, and understand that. Also, make sure if you're going up and down steps that your railings are secure and that you have them. If you don't have railings in your house, please get some in there so that you have something to hold on to as you go up and down the steps. Biggest thing too, making sure that you're using socks with slip-resistant strips on the bottom of them, or house shoes, instead of walking around in stockings and just regular socks, because those are very slippery, and it's a no-no to walk around the house like that. You will be at risk for falls. And lastly, which it should be, everybody should know, but it happens sometimes, is that make sure you're cleaning up all the spills that may happen right away. And I get it. Sometimes it's hard to get down on the floor to clean it up, but you're going to have to go that extra mile, go to the cabinet and get the mop and clean it up, because sometimes you forget it's there, and next thing you know, you come back and you have hit the floor. So that's very important. And the reason with all these falls is as we get older, we lose our ability to be able to maintain our balance and to be able to adjust when we're losing balance. So you see young people all the time about to trip, and they do this, and they make it, and they're still on their feet. Well, it doesn't happen like that for us, because our reaction time is slower. And so we don't always maintain our balance in a way. So this now leads us to balance, because we don't want to fall. Like, that's just it, right? All the other things that balance does, the biggest thing that we care about is we don't want to fall. We don't want to break our hips. We don't want to break our shoulder. We don't want to break our knees. So let's talk about balance. The definition, the easy definition for balance is the ability to maintain control of the body's position, often while remaining upright. However, the more technical definition of balance is the body's ability to maintain its center of mass over the base of support. Does that make sense to anybody? Some people. So let me break it all down for you, okay? So center of mass, also what we may refer to as center of gravity, it's a point at which the mass of the whole body appears to be concentrated. So your center of gravity, I'm going to step out. Let me step over here. You hear me a little better. Center of gravity for someone who has a correct posture. So when I'm standing like this, I am in what we call the anatomical position, okay? My head is straight, I'm erect, hands are facing forward, I'm facing forward, toes are forward. My center of gravity, and most people's center of gravity, will lie right in here, in my abdomen, in the pelvis area. You know what the sacrum is? Is right under your lumbar spine, in the pelvis. So right around there, vertebrae number 2, that's where your center of gravity is. However, not everybody is upright. Some people are like this. So if I'm standing like this, can anybody guess? Where's my center of gravity now? Where is it? Back here. It's not even in my body. It's outside of my body. What happens when I'm here? Where's my center of gravity? Forward. So most of my mass is coming this way. And so my instead of right here where it needs to be. So, in order to have balance, right, my center of mass, my center of gravity, needs to be within my what? Base of support. What's my base of support? All right. Okay, there's going to be a test after this, so I hope you're paying attention. Okay. The base of support is the area beneath an object or person that includes every point of contact that the object or person makes with a supporting surface. This can be body parts or assistive devices, crutches, canes, walkers. So, I'm standing, my center of gravity is here, my base of support are my legs. They're under me. But what if I have a cane? Now my base of support is here. So did I increase it or did I decrease it? I increased it. Now what if I want to stand like this? Have I increased my base of support or have I decreased my base of support? I've decreased it. So what happens when you're a person who's walking and you have difficulty with your balance? Are you going to increase your base of support or are you going to decrease it? You're going to decrease it? If your balance is not right, you're going to increase your base of support. So now you're going to be walking like this. You're going to open up your base of support because the more narrow your base of support is, the more balance you need to have. Because don't forget, my center of gravity needs to be within my base of support. So if my base of support is narrow, I mean, my center of gravity can't get any more narrow, right? So I have to be able to balance. But when my center of gravity is here, what can I do? I can give it some support, right? By increasing my base of support. So that's what walkers and canes and assistive devices do. It helps you to increase your base of support so that your center of gravity can have support so that you can be upright. Now, the reason that I'm making such a big point in this, because I know it's probably people in this room who will not use their cane. You came here today and you didn't even bring it. And I'm going to find you. It's not hard. I'm going to see who you are. And I am telling you right now, if you want to stay on your feet, if you want to stay out of the hospital, if you want to stay out of physical therapy, please use your cane. This is the same as telling someone who doesn't see not to wear their glasses, or someone who doesn't hear not to wear their hearing aids, which there are people in here who are doing that too. But it is important. It's for your safety. It's for the safety of people around you and your family members. It's not embarrassing. If you need a cane and you need a walker, utilize it. It serves a purpose. Doesn't mean that we can't work on the balance with it, but it's important to use. Okay, let's find where I am. All right, so what controls our balance in our body? The brain uses sensory input that receives information in our eyes, in our ears, our nervous system, and our musculoskeletal systems. This includes our joints, our tendons, and our muscles. The main part of the brain that controls balance is called the cerebellum. The cerebellum is located in the base of our brain. Just giving you that information. But let's go backwards and let's review that the balance is controlled by sensory information that is put into our brain through our eyes, our ear. Oh, you guys are not doing good on this test. Ears. And also so I said nervous system and musculoskeletal system, but what we call it, when the nervous system and the musculoskeletal system work together, it is called neuromuscular system. So what we call also our somatosensory system. So our eyes, I told you, when you are getting up at night, you need to be able to see. So our eyes play a role in our balance. If you can't see it, you're going to depend on other senses in order to know where you are and what's going on in order to be able to maintain your balance. In your ears, it's not about hearing. Inside of our ears, we have an apparatus called the vestibular apparatus. It's in each ear on each side. So there's a little sac, and it has all these crystals in it, And then there are 3 canals that we call semicircular canals. Now, they play a huge role in our equilibrium. Now, there's a dysfunction that you can get when the vestibular system is not working. Have you ever rolled over in bed and sat up and the room was spinning? That is a dysfunction, not always, but of the vestibular system called vertigo. Yes. And vertigo, let me just tell you for people who usually don't know, is treatable by physical therapy. Just a little plug. Yes. I'm a neurotherapist, and so I treat, that's my specialty, vestibular. And what happens is there's crystals in that little sac, and it should stay in that sac. But sometimes the crystal gets dislodged and it goes into one of the canals. Typically, it goes into the posterior canal, but it can go into one of the others. And so what we have to do is we have to move your head around so we can get that crystal out of there so that you can calm down and get up and turn your head. So what stimulates the vestibular system is turning your head. And that's why when you're having vertigo, whether you are paying attention to it or not, you stop turning your head. And you look like this. Because every time you turn your head, you get dizzy. And whether you're thinking about it or not, it's happening. And it is affecting your equilibrium, which in turn will affect your balance. All right, and then the last system I told you about is somatosensory. And so that is how our nervous system plays a role with our musculoskeletal system. We have receptors in our joints and tendons that is responsible for what we call proprioception. Have you ever heard of proprioception? Proprioception is the body's ability to sense movement, action, and location. So if I close my eyes and I touch my nose, I know that my nose is here without having to look at it because I can feel it, right? I know that the microphone, let me hit it, okay, is here because I can feel that. Proprioception is telling me where I am right now. I know the podium is right in front of me. I know that there's a table off to the side. Because my proprioception, I have the ability to sense things that are around me. Okay? Again, all of these things start to diminish as we get older. So it's not as easy for you to use your proprioception as you should when you don't have your other senses playing a role. All right. But let me tell you the good news is that balance can be improved, okay? Balance can be improved when we help to increase our muscle strength, when we help to become more flexible, and as we train our balanced senses in order to be able to stay upright and to keep our center of gravity within our base of support. Okay, that's okay. Yes. Right. So, biggest thing is very important. You need to stay strong. You need to keep your muscle strength up because your base of support, if it's weak, what's supporting you? Have you ever seen somebody with a walker and they're here? Their body is all the way out here and their arms are here. That's a person that's about to fall. They are about to fall. They can't keep up with that. Because what is their center of gravity? What's under it? Absolutely nothing. This person is not going to. This is why it's another thing. People, you know, when they have walkers, they always want, can I get a rollator? A rollator is the 4 wheels with the little chair. But not everybody can walk fast enough to keep up with a rollator. The rollator is moving. Those are the worst ones. And they're back here, running behind that rollator. Again, somebody who is at a huge risk of falling. That's why it's important to be able to stay strong. We need to work our lower extremities, walking, doing exercises and things that keep it strong so that we can help to maintain our balance. Also, working your muscles helps with working your nervous system. And also, as we work our balance, we are working our nervous system because we are stimulating our stability so that we can make sure that we're keeping those things sensitive so it can help you when you're going through your day doing those things in an upright position that sometimes make it hard. All right, so right now I'm going to take a moment. I'm going to stop and I'm going to answer any questions because the next phase we're going to go into is I'm going to do a few balance tests to show you guys how we can Listen, if you know you have problems with your balance, you need to talk to your doctor about that. Your doctor will send you to physical therapy. If not physical therapy, working with a trainer who, specializes in geriatrics or older adults that knows all about this type of stuff. Because I've seen people like go to a trainer, you're in the gym and you're thinking, why is she running? Like, barely making it. So you need to work with someone who understands how it is to be with older adults and what their issues are and how to maintain, because your goals are different from somebody who's 25 years old. Their goals, everybody wants to lose weight. I got that. However, that's the that's the gravy with the meat and potatoes, right? Or with the Morning Star and potatoes. That's the gravy. What we really care about is our quality of life and how much we can function and how much we can maintain our independence. That's the biggest thing. Being independent as long as possible. So we're going to go through some of the tests. I'm going to show you some of the things that we're looking for. Yes. Yes. In the back. I suppose you can break your hip and fall. Typically, a person that will break their hip, then they have other issues. More than likely, someone you find who breaks their hip before they fall may have osteoporosis or some sort of something where their bones are weaker, and so the stress of just walking and standing can cause the bone to fracture and cause pain. That happens. It's just like any other dysfunction. But typically, you're going to find, and that's even worse, someone who has osteoporosis who may not, have a stress fracture or break their hip just by movement will fall, and they have a very high likelihood of breaking their hip. So it is also important to make sure you're getting your DEXA scans and you know your bone density. So and you're taking your calcium and the medication that the doctor gives you. Because there's also, some medications that rob you of your calcium. And so it's important to have those type of conversations with your doctor because, of course, the benefit for the medication may outweigh the negative, but you need to know that, and you need to be able to counter it with diet and supplementation. Any other questions? Here I am. Yes? Yeah. Mm-hmm. So typically, whole shoes, sneakers, a completely covered shoe that supports your arches and that fit well are the best type of shoe that you can wear in order to help you maintain your balance. So let's talk really quickly about the ankles and balance. So if I were to be standing here, can you see me? Okay, let me stand here and just talk loud. I can talk loud.
Yes, you can.
Okay. So I'm standing here, right? And someone pushes me. I'm going to go forward. I'm going to catch myself. Let's say they push me back. I'm going to go forward. This is called ankle strategy. This helps me when I'm being pushed out of my base of support. I can react. Not everybody can react like that. Then, let's say they push me harder and I step. That's called hip strategy. That's a reaction. I can react and catch my balance. They push me to the side, I can step. Not everybody can do that because our reaction time slows. So you may get pushed and your ankles are not going to do what it needs to do in order to bring you back to upright. And you go forward. Also, mainly in older adults, what you see is, because there's also the knee bending. Somebody pushes you and you bend your knee. But you bend your knees and guess what happens? They all fall down. Yes. And so we like to use our knees, but it's important that we are using, our ankles. So we're going to do a few exercises that teaches you how to strengthen those areas so that you have the ability to catch your balance. The other thing you like to do is this, right? And one of the most common breaks is the radius. It's called a boosh fracture. Falling with outstretched hand. And I laughed when I was in school and I heard that. I said, that's ridiculous. Who named that fracture? But it's a real thing, isn't it? It's a real thing. And it happens a lot because the first thing you want to do is you want to put your hand down. What are you like, really? I mean, you can't even stand up. You think you're going to catch yourself. But it's a reaction. It's a reaction that we do. All right. So, any more questions? Yes. 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 So that is also a big risk factor. People shuffle, and the reason people shuffle is a really simple answer. People are afraid to pick up their feet because their balance is poor. So just look at it. Watch me walk. Just gonna walk right. There's a time when I'm always just on one foot, right? So I'm walking and I'm only on my left, and I'm only on my right, left, right. You don't have good balance. You don't want to be on one foot ever. So they don't want to pick their feet up. So they're going to shuffle. But guess what shuffling does? Guess what shuffling does? What's under me? Carpet. I'm a trip and fall. And so those are what we call gait. Gait is walking, gait disturbances. Another thing that people need practice with. And this is why, what can you use to help you feel more comfortable as you're walking and picking your feet up? What can you use? I wish we had something that we can use to help us when our gait is poor. Nobody's ever created anything, or maybe they have. Have they? Yes! Okay. Yes. So I don't want to pick my feet up, but guess what? When I step with my left, don't I have something down on the right? Yes. So every time my right goes up, I now have increased my basis. Okay? Now I have something on the other side to help. Same thing. So if my weakness is on my left side, I hold my cane in my right side. If your weakness, and then this is people who have not been trained to walk with a cane, always mess this up. If your weakness is on your left, you hold it on your left. And that makes absolutely no sense. Because now this right is up and you're just like, you want balance. You want, because now you need this strong leg that's always giving you support is no longer there. You need something that's going to give you the support that you need when that lifts. So that's why you put it on the opposite side. A lot of times we find, and I'm going to give you this one for free, the next one I'm going to charge you. People who carry their cane on the wrong side always end up with sciatic nerve problems. Why? Because you're putting all your work on that side. That side is already weak. And then you're not even giving yourself any support on that side. And now you're just like, your poor hip is taking all that pressure, and it causes sciatic nerve pain. So if you have sciatic nerve pain and you're not using your cane, B, using it on the wrong side, please switch to the other side or get a cane. Very easy to get. Walmart, Amazon, the doctor, anywhere you'd like to go. Also important, let me just put this out there, to make sure you got your cane at the right height. This cane is super long for me. The cane should be hitting me right here. This little knot right here on my wrist, it should be hitting me here. This long cane, I don't know. People love it. I see people in the street and I say, oh, let me see that cane. And I put it down. And they go, put it back. And then guess what I do? I give them a card. I see you in 2 weeks. Yes. So, anyway, this is, any other questions?
Maybe about Carrington advances. That's also that we have one up and down.
Yes. Oh, it's important. it's important to make sure when you're going up and down the steps that you have, if you're going to use railing, you're already having issues with your gait and going up and down steps, and you don't have anything to hold on to. So make sure that you have that hand free so you can use the railing, because there are some things that can happen. You can even drop everything and make it, it can become worse than it really is. And also understand, like, tripping is also not something you want to do. You don't want to trip because you're not fast enough to catch yourself all the time, okay? So you don't want to trip. You want to make sure that you can get that foot up. Another thing, you have weakness in your leg, that side, that's the side you want to go up with your good leg. We always say, go to heaven with your good leg. So instead of doing a reciprocal, one after the right, left, right, you just climbing with the right because your left is weak. So all your pressure when you step up is going into that strong leg. When you have a weak leg, that's why it's so hard to lift yourself to the next step. When you go down, we're going to, hell. With our bad leg, okay? So you lead with the weaker leg. Why? Because when you're stepping, again, if I'm stepping with my weak leg, this leg is back here. This leg is giving me all the support. All I got to do is lock this knee out. This knee is straight, this knee is here, and I need to put all my pressure when I bend my knee on this leg. That's why a lot of times people are trying to go down on their weaker side. They go down with the strong leg first. The supporting leg is back here, and they buckle, and they fall. So you go up with your strong, you go down with your weak. All right? These are all things that, if you go to physical therapy, say, I know, up with the strong, down with the weak, they'll be so impressed. Yes?
How you doing? Like myself, I have multiple sclerosis.
Uh-huh.
And all the medication you just listed as mandatory from all the devices, the assistive devices I have to use. I do my best. I'm younger, so I do my best not to use it, and I'm hard-headed because I have to use it, just like you said. But I just wanted you to just go over like having to run to the bathroom.
Yes.
For instance, like what was your best advice?
So,
I know right now, we sitting down, everything is all good. We chilling, but with the time happening, like.
right. So I would say because of the diagnosis you told me,
Yeah.
with the way that the bladder works, I would probably put myself on a schedule where I know I need to go to the bathroom at these times. Because if you wait until you can't hold it anymore, it's just not going to work well. So you know you just drank a whole bunch of water, you give yourself 10 minutes, just go to the bathroom. Trust me, you'll go. Empty your bladder. Try to do it at certain intervals and don't wait until the last minute. But always keep your device close because you're going to need it. Because who are you sitting with? You are caregiver. His caregiver. If you fall, can you pick him up? No. Yeah. Can you get out from the floor? No. Sometimes no. No. Right. So you don't want to go down. You don't want to go down. Right? So my advice to you is always keep that assistive device. I get it. I understand that it's not fun, especially being younger, having to walk with an assistive device. But let me tell you something. You think that I don't want people to see me with this. But people already see how you're walking, so they know something's wrong. But let me tell you what an assistive device does. There are times when there are some people, they don't need it that much. Let's say even someone has broken their arm and now they have healed, right? But they want to go to, tonight, they're in DC and they say, I want to go see the fireworks. Our suggestion to them is wear your brace. Not because they need it, we've already taken them out, but what is the brace? When you see somebody with a cane or walker, what do? You give them space. You letting everybody know. You're letting everybody around you know, be careful when it comes to me. I need you to move slower. I need you to give me my space. When they don't know, they bumping and pushing you. I pushed someone in the elevator this morning, and she had a cane. I was trying to get out of the elevator, and she was standing, and I bumped her. And So anyway, imagine if she didn't have a cane. I probably would not even have known to try to help steady her. But those are those things. You got to get past that portion of it because it's not safe. But you keep doing your exercises, keep practicing, and remember, put yourself on a timer. Try to get yourself into a schedule when you know you need to use the bathroom. If you know you've eaten or had something to drink, you know what's coming. Get yourself there and definitely use your assistive device. Let me see it. Oh, you don't have it. Oh, there you go. Good job. Good job. Okay. And yes. Physical therapy can help with arthritis. I mean, arthritis is the breaking down of the joints for certain different reasons. And what happens is when you're strengthening the muscles, it stops putting all the stress in the joint, and your muscle is able to absorb a lot of the stress. So it helps to keep you mobile without so much pain. Also, flexibility and stretching and, lubricating those joints is helpful. Yes, it does. Yes.
For myself, I've been going to this therapist since April constitution for a year and a half. And yes, I haven't been better, but I'm not.
Well, the therapist will let you know. I don't know. I have to be there. Yeah, your therapist will let you know. They'll let you know. Every so often, they do another evaluation. They see how strong you are, how much change you've made, and they have an idea of how much change they want you to make. But let me tell you guys something that people don't always want to accept. Physical therapists we're not the end all be all. We don't have a magic wand that we, wave around and all of a sudden you're better. It's your job. You have to do the work. When we give you exercises, go home and do them. 1 day a week, 2 days a week for 30 minutes, 45 minutes, and you guys go to therapy. You know you're not our only patients. We're leaving you, coming back, running around, writing notes. You see what we're doing. We need you to help. And we're just giving you the game plan, and we're expecting you to execute it so that you can get better. When you work with athletes, you go in there, you work with them one time. How do you think they get on the field on Sunday? They got to practice. Practice? Yes, practice. And so that's what you guys need to do in order to get yourself, moving and going. And I tell everybody all the time, if you have it and you're able to do that, find a trainer, somebody who's going to come out and work with you twice a week, 3 times a week, who helps you to do it. Trainers, sometimes they may not teach you anything new, but they keep you moving. They make you accountable. They make you do it. So, you go on, you're here, you're on vacation. Guess what? When you go back, because they want their money, right? They're like, hey, you want to get back on my schedule? Because if you were doing it yourself, it'd probably take you August. You say, oh, let me go for a walk. You know how it is. So anyway, what I did forget is that this mic can move. I'm sorry. Anyway, all right. So we're going to move on to the next portion. Doesn't mean you don't have questions. If you do, just go ahead and raise your hand. So we're going to do some testing. So, you know what? This first test that we're going to do, we all do it together. So let's everybody stand up. So this test is called a Romberg test, okay? We're going to do some of the Romberg. We can't do all of it because I don't have a map for everybody. But this Romberg test is a simple test, and it helps me to understand your balance, what's called static balance. Static standing means you're not moving, just standing here. You need balance. Why? If I'm standing here and I want to reach for this, I have enough balance, but some people can't reach like that. They can reach here. They can't reach out of their base of support, so they're not going to be able to do that. So static balance matters too, and I don't know why people do this all the time. You're walking and you say, oh, go get that paper, and they stop right here, and then they reach for it. Like, walk up to it. Go up to it. Why are you reaching for it? Okay. All right, so what I want everybody to do, cross your arms over your chest, bring your feet together. This is called narrow base of support. Touching, touching, touching. Everybody's feet is touching. Touching. All right, and let's hold this for 30 seconds. Let's see how many people are going to be. Pastor Medley failed. I'll teach him how to walk with this cane. All right, 10 more seconds. This is easy, I know. Okay, keep that position. Close your eyes. I see 1, 2, sway, sway. 15 more seconds. Okay, and open your eyes. All right, you can sit down. There's one more to this test. However, you can't do that. So let me just tell you what we did. So we did something called the Romberg test. And what I did, well, some of it, partial. Also, we use this, it's called sit-sib, and this helps me to know what part of you is impaired. So the first one, you're using all your senses. You can see me, you're standing on stable surface, and you're using you don't have to use your proprioception that much because your eyes are open. But then I made you close your eyes so you don't have vision anymore. Now all you're relying on is your vestibular system and your somatosensory. We're on stable surface. When I put you on a non-stable surface, I take away your somatosensory. Those of you who were swaying says to me, your vestibular system isn't that strong. And it happens. Doesn't mean you got vertigo or anything like that. It means you just have a weaker vestibular system, and we got to work on that. Or possibly it could be your somatosensory. Something between those two, which you needed in order to maintain your balance, was not doing what it needed to do all the way. Okay? All right. Let's try this one. This is the last portion of it. Yeah. So I want you to stand on here. You can turn and face everyone. Yes. Put your feet together so they're touching. Cross arms over chest. And we're going to hold that for 30 seconds. So now what is she using? She's using her vision. She's using her vestibular system. But I'm distorting her somatosensory. This pad is kind of wobbly and cushiony. So her proprioception is not going to be at 100. But she's making it. She's doing a good job. So in a second, I'm going to now take away her vision. Close your eyes. Let's see what she does. There you go. Ankle strategy. You see it? If she came to me in a clinic, I say, well, she works out, so I don't think it's her muscles. What do you think is going on here? It's her vestibular system. It's a little off. Yep. This is normal. She's trying to find her. There you go. All right, and you can open your eyes. She was trying. So see, sometimes as we get older, we don't have the ability to find our center. She's trying to find it, and she can. Eventually, she stabilized. The trick would have been for her to put a lot of focus on those ankles and stabilize those ankles. But she wasn't stabilizing her ankles. She was still trying to use her body. Use your ankles. Yes. Are you able to do it? Possibly. Maybe when we're done, I'll see how you do with it. Okay? I don't want nobody falling in here. Yes. This is my colleague, Miss Davis. Oh, yes, wearing high heels definitely affects balance because it distorts your somatosensory. So now it changes your base of support. So you're definitely going to be off balance especially if the thinner the heel, the worse it is. The higher the heel, the more it challenges your balance. So if you have problems with balance, falling, tripping, stop wearing high heels. The wedge, because it's more in contact with the surface, but again, the height is gonna, because then remember what you're using in your body. So now where is it? Where have I changed your center of gravity? I've made it anterior because you're here now. Instead of being upright and even, it's not here anymore. Very good. Thank you. Okay, yes. Mm-hmm. Well, then we get into other things. We get into what's going on with your arches, what's going on with your ankles, and if you're pronating or supinating and all those things. And those are things your doctor, therapist will help you more with by putting things in your shoes if necessary. Not so much balance, more than ankle issues, which probably indirectly can lead to that. But that's not normally the first place we go when we find somebody that's having that's at high risk for balance. All right, so that was called the Romberg test, and then eyes closed, putting you on the pad, this AirX pad, is called a sharpened Romberg test. So that basically just kind of helps us to understand which system is weaker. And guess what? It's everybody with eyes closed, because we're taking away one of the senses. Everybody's going to do that unless you're, I don't know, 15 years old and you run track and you do all of that stuff. All right, so the next exercise we're going to do, the next test I want to show you is called a dynamic gait index. All right, so this one helps us with movement. That's called dynamic. So that means as we're moving, which is mainly what we have problems with. So Pastor Melly, let's test his balance. There is going to be one thing that I'm not going to be able to do with him. But let's see how he does. All right. So, all right, let's start back here. So just listen to what I ask you to do, and I just want you to do it. All right, so I just want you to walk normally at your normal speed. Just walk forward normally. Walk fast. Fast, fast, fast. Walk slow. Good. Stop and turn around. Good. Keep coming to me. Look to the left. Look to your right. Good. Look up. Look down. Good. You can stop and turn around. All right, let's keep coming. Let's walk forward. Turn around. You walk faster than I was expecting. All right, come on and step over that. Good. Let's come back and walk around it. And then there's one around it. Oh, he failed.
I said, sir, you didn't say sir.
Okay. All right, and you can stop. The one more thing that I would look at is how he does going up and down steps. So if he had to stop and then go over that, that would have taken his score down. If he would have turned to the left and lost his balance, that would have dropped his score. There's another test that we do where you walk backwards and you walk with your eyes closed. If those things causes his balance, his gait changes, he's not able to keep up the same speed as he did when he was walking normally, those are all things that will drop his score and tell me he's going to be more at risk for falls. Okay? So there are 8 things that I ask him to do. I want to think. Anything that he scores 19 or less says that he's at risk for falls. Okay? Let's try this together. Another thing, everybody, put your things down. Sit on the edge. Sit in your chair normally. All right, feet are flat on the floor. What I'm going to ask you to do is I'm going to ask you to stand up and sit down 5 times. Not yet, not yet. I'm going to time you. I'm going to see how long it takes us. So, here's plot twist. No hands. Only your legs. No hands, right? I was trying to remind myself. Can you define no hands? It means no hands. I want you only using your legs to get yourself up. You can cross your arms over your chest. All right. Let's see how we do. Ready? And go. 5 times. 1. At a normal pace. No momentum. Who? Are you guys still going? 5? Have you done 5? 5? Okay, all right. I did see some people that didn't stand all the way up, so that you cheated. If you were we'd make you do it again. You got to stand all the way up. Your hips up, up. Not here, here. Okay. So anything that some people, it can take them more than 30 seconds to get up. Some people never get through one. They can't get up without their hands. They need their hands to push, and because they don't have enough strength in their lower extremity, at risk for falls. Yes, I have an answer.
Okay, is it so that walking backwards helps you balance?
No, well, walking backwards is helping your proprioception, right? You can't see where you're going, so you don't have that sense. So I just need to know, okay, what's behind me? I know there is a cord somewhere back here, so we want to make sure that you're able to sometimes work around things you can't see all the time. So, yeah. It can help. It helps to increase proprioception. One of the things we do when we're doing balance exercises was we tell you all the time, don't look at your feet. I'm looking at your feet. I don't need you to look at your feet. You got it. I want you to know where you're going. I don't walk like this, because then what's something coming at me? I'm not going to see it. I have to be able to trust that. And that's another thing you see people with poor balance who are at risk of falls. They look down. They want to see what's their feet doing. What's their feet doing? The same thing it was doing when I told you to pick them up. So that's because their proprioception is poor. So that's what walking backwards helps to increase that. It's another technique to help increase balance. The quick and dirty. Okay. Here's a good one. All right. The next one. Everybody stand up. We'll do this one together. This is called functional reach. Everybody stand, hip width apart, not too far out. See, those of you that like to stand like this lets me know that you don't feel comfortable standing in a static place without feeling like you're going to lose your balance. All right, this is what we do. This test really right now will mean nothing. I just want to show it to you because I don't have a measuring stick to measure how far you're reaching. But let's put out your dominant hand, right hand usually for most people. All right, and I want you to reach as far as you can without losing your balance and stepping. Reach as far as you can. Okay, and good. Come back up. Okay, once you start translating, your knees are bending, you start stepping forward, I know that test is over. So if you cannot reach more than 6 inches, you are at risk for falls. So all of these tests one at a time, unless we're doing like the functional gait, the dynamic gait and the functional gait assessment. The one test is not the only factor. We're going to do a few tests because we want to see what you can do. And if I don't know, maybe you just have really tight hips sometimes, or maybe your hamstrings are super tight and you can't really reach forward. So it doesn't necessarily mean you are at risk for falls, but if you're failing my Romberg, I haven't even asked you to close your eyes, you can't reach, you didn't get out the chair for the 5 times sit to stand, you're probably a fall risk. All right, you can have a seat. And then this test typically, though, is a test that we usually do with people who have had a stroke. So it's kind of long. I need a chair, any chair. And I need Pastor Medley. This is called a Berg balance test. Has anybody ever done a Berg balance test before? Okay, so you can have a seat. There are 14 different tasks that he will do. He can score 56 is the greatest, and let's see where he is. All right, so the first thing I want him to do is, please stand up. Try not to use your hands for support. Oh, he passed. Okay, so I want you to stand here, unsupported, and if I'm not going to do it, he would stand for 2 minutes, just like this, unsupported. Because sometimes you think you fool us. You can stand for 15 seconds, But standing without touching your walker or anything for 2 minutes gets a little difficult, right? Upright posture, it's a lot. It's not just his legs, but it's also his hips, his glutes, his core. He has to be able to support himself for 2 minutes. It could be a little taxing on some people. All right, now let me see you sit down without touching the chair. Don't use your hands. That's better. Let me get this. Can I get this? All right, so I want you to scoot a little bit more to the front of the chair. Cross your arms over your chest. Just sit there. So he sits now unsupported, not holding on, not leaning against the chair for 2 minutes. Again, not always easy. Someone who's had a stroke probably may have some trunk problems, so he's not going to be able to support himself. It'll be hard for him. I know it sounds silly, but it happens. Okay. Next thing I would like for you to do is I want you to stand up and I want you to sit in this chair. Good job. Good job. All right, now let me have you stand up again, and we're going to close your eyes now. This one is a 10-second. Let's see how he does. Okay, and stop. All right, now feet together, touching. Okay. And close your eyes. Actually, open your eyes. Sorry. You keep your eyes open. And this one is a minute. We stand with a narrow base of support, and his feet are touching. They're not open wide, but they're touching. Now, let me tell you this. After we do this, please don't go around telling people, you have balance problems. Your feet are too wide. You need to... Please. No. People will figure it out. Now, if they fall, you might want to have that conversation with them. But you'll notice, in other words, people who you know are dealing with balance issues by the way they're standing and by the way they're walking, that you can tell. All right, you can stop. All right, want both hands at your side. All right, let's see how far I forgot my tape measure. Let me see how far, with your right hand, you reach. And reach forward, forward, forward. Okay, good. We want him to be able to get at least 10 inches. Okay, and come on back. Very good. Okay. Can you pick that up? Give it to me. Thank you. That's hard for some people. Can I see you? Look at me over your right shoulder. Good. Now look at me over your left shoulder. Do you see me? Okay, keep trying to look at me. Okay, now can you turn around 360? All right, good. Now, if I had a stool, I would ask him to put his right foot on the stool, and he would stand there as long as he could. So lift your right foot and you think, so what's happening now is, yes, both feet will be supported, but his base of support will be a little different because you got one here and one back here. So it's more narrow. Then as long as he can, he'll put it down, and then we'll do the other side. He'll put his foot on a step, and he'll hold that as long as he could until he started moving around. And you can stop. But let me just show you guys something. You can stop. Did you see how hard it was for him when he stood on his left side? Then he started showing off on his right side. Why didn't you do that when you're on the left side? That left leg said, no, 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 no. Right. See. And so we also, everybody, we're not always going to be equal, right? We're not symmetrical all the time. You're going to have a dominant side. Sometimes your dominant side is the side that you actually, you're right-handed or left. Sometimes your dominant side is just your stronger side. And so that's normal. But it's also important that we're sometimes training things single, one at a time. Because when you're doing both, guess what? You're using your dominant side more than you're using your weaker side. And so you'll continue to maintain an asymmetry when you want to be symmetrical as much as you can. All right. The next thing would just be lifting one leg, and he's going to hold that for 30 seconds. Ankle strategy. See how that ankle is going? Plant that foot. Think about the middle of your foot and push that through the ground. Yeah, you prefer to be bare. Yeah, he likes, Pastor Melly is martial arts, so he has more balance without his shoes on. All right, and you can stop, and let's go to the other side. Now, the ankle strategy will not cause him to fail. What causes him to fail is putting his foot back down.
Yep.
Left side. Woo, that left side is not. He's cheating, but that's okay. You can, you can put your foot down. All right.
One second, focus.
All right, so I want you to place your right foot in front of your left as close to it as possible and hold that. So we do that for 30 seconds. That's a narrow base of support. That's called tandem standing. And then let's switch. Okay, and stop. What time do we have? All right, almost there. Okay, you can stop. So that was the Berg balance test. All of those things give us what we need. Typically, that is the gold standard for people who have had strokes. This is how we find their weaknesses, and we work on their balance from what we find there. Okay, the next one, can you count out 10 feet for me, please? This is called the tug test. Come to the chair and just count out 10 feet. And yeah, this is called a tug. This is the easy, quick and dirty test that we use to check people's balance. Tug, 10. Okay, so tug stands for timed up and go. So he's going to go back to the chair and have a seat. He's coming back to the chair. He'll have a seat in the chair. All right. So what this test is going to make him do, he has to stand up without his arms. He can stand up. He's going to walk to the green cone, normal pace, walk around it, come back, and sit down in the chair. The chair starts. If he had a walker or a cane, he could use it. The test starts when he gets his bottom out of the chair, and it ends when he puts it back in there. Okay, ready and go. Normal pace, he's running. And sit. Good. 9 seconds. Anybody who can't do that in 13 seconds are at risk for falls. But sometimes you find people struggling to get up. It's like, oh. It kills me. I want to say, get up. But, you can't help. So, last test we're going to do, quick and dirty, most difficult test. This test, to me, is so difficult. However, we use it all the time because it's very fast. But if you're going up to talk to a person in the hospital or anywhere, you know they have balance problems. Why would you even do this test? You know they can't do it. But it gives us something to say. This person is really struggling with balance, and we need to work on it. So everybody, let's stand. This is called a single leg stance. Easy, 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 peasy, peasy. We're going to do 30 seconds. So I want you to hover over the chair in front of you. That means put your hands there. In case you lose your balance, you can put your foot down, or you can just put your hand. So come closer. See, there you go, reaching. Forward, forward, come forward. Yes, and hover, just in case you need something to hold on to if you lose your balance, okay? However, once you touch any object with the other leg or your hands, the test is over for you. All right, so let's see. We're going to lift our right leg first. Starting on our left side, let's see who can stand for 30 seconds on one leg. Ready, and go. Some of you are doing a great job. I'm about to fail. And stop. Good. All right. Other side. Now we're going to stand on our right, lift the left, and go. Your right side is your weaker side? Mm-hmm. Mm-hmm. guys feel your ankles doing all that work? Yep. So you guys, have you had anybody ever worked in physical therapy or work with a trainer? You can stop and have a seat. Have you ever? As I was just tell you something that you already knew. We want you to fail. We want to see it hard, right? In the beginning. Because we want to show you that you improved. We want to show you, because if you could do everything easy, so if you do that and you're just looking at me like, 25 seconds, 30 seconds, I'm going to pull this out. And you stand on this with one leg. Now close your eyes. We're going to find a way to make you lose your balance. So I know you've been believing that at home, and it's true. We do. It's very upsetting. I'm going to tell you what I tell my patients all the time. The worst thing you can say to a personal trainer or a physical therapist is after you finish an exercise, okay, what's next? Oh, that grinds my gears. I'm about to torture you. Okay, so here we go. Let's do some exercises. So those were just the tests. Yes, ma'am. Exactly. Right. Exactly. So she said that she was able to do the 5 times sit to stand. However, she can't do that in every chair. There are some chairs that are too low, couches are too soft. So let me tell you. So that is a physics problem, okay? So when I'm here, quick education. When I'm here, my hip is 9 degrees, and it's in line with my knee. My knee is 9 degrees and in line with my ankle. Now, if I'm in a chair where I'm here, my hip is no longer 90 degrees and in line with my knee. So now I have lost weakness in my quadricep muscles because of the angle of where I am. So if you're going to sit in a chair and put something in it. Give yourself a little height. The other thing is, so here's the thing. So you're sitting in a chair. Let's just assume my chair was low. And what do? We scoot and scoot to the end of the chair. Now let me show you something. If I lean, I bring my feet back as far as I can. I want my feet to come back. If I lean forward and I bring my shoulders over my knees, over my toes, look, what are my hips doing? I'm not even trying to get up, but they're lifting, aren't they? Now I put all my pressure through my legs and I can stand up. So the couch is here. You're leaning as far as you can. Give yourself a little support with your hand. All you got to do is get that load up. Get that load up. Ms. Davis has something to say. Yes, ma'am. Oh, I thought you looked like you wanted to say. Add. Yes, nose over toes. That's what we tell everyone. When you lean forward, you want to make sure you're leaning as far as you can so your nose is over your toes. And you just push that weight anterior. Shift it forward. If I shift, I'm going to pop up. That's like reaching. You're going to go forward. It's easier said than done. However, with practice, it does get a little better. All right, so let's go through some of these exercises. All right, everybody sit at the edge of their chair. You can use your hands if you need to. All right, so I want you to have your feet hip width apart. Bring your toes back. Feet back a little more. Good. Lean forward and let's stand up, nose over toes, and come up. And sit down. Sit all the way down. No plopping. Control yourself going down. Let's do that 20 times. There you go. That's 1. 2. I see some plopping. Control that going down. 2. 3. If you have a problem with balance, please make sure you're reaching for the chair. Know that it's behind you. 20. What number are we on, guys? 40. 19, 20. You can sit. All right. Okay. Next exercise, we're all standing. All right. Hovering, come closer to the chair in front of you if there's a chair in front of you so that you have something to give yourself support. This is tough. All right. Yeah. So, first thing, let's take that left heel and put it in front of our right toe. Touch it. If it's too hard and you can't do it, take the heel and put it right here beside that bunion. All right. Now, let go. Let's try to hold this for 15 seconds. Timer's back there. All right. The most difficult leg on this one is the leg in the rear. So, guess what I want you to do? Shift your weight back. Put your center of mass over your base of support because you're here. All right. Stop. And let's switch. Heel to toe. Good. And hold. Yeah, stand up straight. Stand up nice and tall. Squeeze your glutes together. Use your core. Pull your belly button into your spine. Breathe normally, but make sure that your posture is upright. All right, and you can stop. Good job. People didn't look bad. That was great. That's the most difficult one. We've already practiced the single leg stance. Let me show you if you're at home, you can stand in a corner because in a corner, more than likely, you have the walls to hold on to, or you can stand in front of a counter. Please don't hold on to something like some little folding chair that's going to bend over when you try to grab it because you're falling. Use something that is stable. Just pretend you got 2 water bottles, you drank all your water. You have those cans because we're eating whole foods now, so you can use your cans as balancing tools. We're standing behind it, and I'm just going to tap, 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 put my foot down. Tap, tap, put my foot down. Tap, tap, put my foot down. Other side, tap, tap, put my foot down. If it's too hard, I'm just going to tap the orange with my left, tap the green with my right. I'm going to do that 20 times. Tap. Let me tell you what, maybe you can do it, but your balance isn't so great. So what you're going to do, you're not going to tap, you're going to go. It's just a light little tap and back down. We could spice it up. We stand right in the middle of it, and we're going to tap, down, tap, down. Thanks. And tap. But guess what? I can't look at it. I have to find it. Tap, tap, tap. I always tell people do it in front of a mirror so you can see what's happening. And we're just working our balance. Just working the balance, a single leg is dynamic, meaning I'm moving, practicing that. All right, and then one more exercise I want to show you guys, and this is really so you're sitting and standing 20 times. That's like doing a squat. It's helping to work your legs and your hip strength. The next thing we're going to do is called a 3-way hip. We're only going to do 3 movements. The hip does more than that. But the first thing, let's all stand up. Let's finish up on this one. I do have some of these exercises that I made for you guys with instructions, so I'll give that to you at the end so you don't have to remember everything, okay? All right, so you hold on. This one is not balance. This is strengthening the leg. All right, hold on to the chair in front of you if you have it. Let's go with the right leg. The right leg goes out to the side 10 times. If you have a side, 7, 8, 9, and 10. All right. Now let's kick forward. 1, 2, 3, 4, 5, 6, 7, 8, 9. One more. 10. Very good. Now we're going to kick back. Ready? 1, 2. Yes, same leg. The left hip should be hurting now. 3. You feel the left hip? Right, because we're doing something called a concentric activity with our right hip. That's a movement. But we're also doing a isometric contraction with our left hip. So that left hip is working and you can stop. And then we do the other side to make sure it's symmetrical. All right, my goal is to work up to 10 3 times. So 10, rest, 10, rest, 10, rest. First time, you may only do it once. And the second time, you're probably going to need you can add as it gets easier. You can add ankle weights if you'd like. All right, I'm Nikki Carrington, and we've created balance. Thank you.
Let's put our hands together again for Dr. Nikki Carrington. You may be seated. Thank you for these practical, realistic tools. Did you benefit from this? And the challenge for everything that we have when we go through these seminars and workshops, receive information, is only when you practice them do they really take hold of you. So the skill sets that you developed today, please put them into practice, and you will benefit from them. If you want to reach Dr. Nikki Carrington, you can contact the office, and I'll make sure that she knows how to reach you. If you want her to come to your churches, your areas, to do presentation, I'm not her agent. I just simply to ask you that she is a professional, so her coming requires sacrifice, but there's always a fee for professional services. Amen. Even in the house of God. So let's make sure that is done also. Okay, I saw a few hands. You got your handouts from her, and we thank you. Contact Health Ministries, or talk to Patricia Lewis. She is the one who's been organizing things for us, and that way we will get in contact with her. But if you want to come to your area, do some things, I just want you to arrange that, schedule it. We cover things like travel, accommodations, and also honorariums. Okay? We invest in these things, correct? And so I'll speak on behalf of her for that. Again, thank you, Nikki, for coming, and thank you all for being such phenomenal constituents and where this matters to you. I pray that you will remain in health, that God will keep you from falling. Even though a righteous person may fall 7 times and get back up again, let that be a spiritual experience and not a physical experience. So keep moving, keep thriving. God has come to give us life and to give it to us more abundantly. So God wants us to do more than just be alive. He wants us to thrive. So we pray that we would do that and that we would continue to chase Moses. Beautiful thing about Moses, the Bible said that when he was 120 years old, okay, his eyesight was still sharp and his vigor, okay, not abated at all. So that tells me that for all of us, we want to live until God says our work is done. And that we don't do the preventative things because God may want to use you a lot longer. And so we want to make sure that our lifestyle, our holistic lifestyle, accomplishes God's plan for our longevity. Is that all right? And God will bless you for that. And don't forget to go on the Allegheny East website to look at Deliverance, Rooted in Wellness, which is the new initiative for Health Ministries. And Deliverance is an acronym, 11-letter acronym. And each one of the letters is potent with action things to do for you personally and also for others. If you're joining us in the Worship in Motion, because Rhonda is testing us every morning on each one of the letters of deliverance. And I think after the marathon you run tomorrow, there's a written test on deliverance to make sure that you all have it. But remember to come out tomorrow morning for 6 a.m. for our last Worship in Motion. I know she's going to do a summary of all the information, and it has been phenomenal. It is worth the sacrifice getting up in the morning to be there. She has been leading us, pushing us, developing us, and we have one more morning, tomorrow morning, to do that. So this now completes the presentations from Health Ministries on yesterday evening, and today. This afternoon is Youth Ministries and Family Life. They will be doing the family fun activities that start around 1 o'clock, I believe, today. That's all afternoon. Of course, our evening worship takes place today. So this is Youth Emphasis Day this afternoon. And it will be probably outside the gym area, over by the gym area. They're doing a number of things on the outside. So that'll be there. And of course, follow your schedule for the rest of the programs for tomorrow and this weekend. Camp meeting concludes Sabbath evening. Sabbath evening, you'll see some of us in our work duds trying to take camp down. And if you're staying on campus and, we're asking you to, you don't have to go home, but on Sunday morning, okay, you don't have to go home, but just make sure, because when you leave, we can take care of closing campus down so we can go home also. Is that okay? So you don't have to go home. We do have police still here, so we don't want them to have to issue any eviction notices. But thank you. Okay, let's stand. Let's pray together. Father in heaven, we thank you again for today's profound session about balance. I pray, Lord, that you will bless us and that we will put into practice the things that we have learned. Keep us safe in our movement. You've created us to move, and we want to live, move, and have our being in you. And while we're doing all these things, we pray, Lord, that you would help us to put into practice the things we have learned today, to maintain an upright posture, to move and to be healthy in our personal spaces and even when we're in public spaces. Do that for us, we pray. I thank you for each one who has gathered today, and I ask you to continue to cover them. Give them the whole life that they need. Give us all, Lord, longevity and fullness, but more importantly, while we live here, we long for the day when Jesus will come. And you will make all things new, including us, God. And we look forward to that great day, that getting up morning when this mortal shall put on immortality. So hold us, Lord, until that becomes our lived reality. Bless us now as we depart. Be with us throughout the rest of this day. In Jesus' name, amen.